Sacramento Covered, we mitigate the barriers to healthcare by educating, by empowering people on how to use and utilize their insurance. We assist low-income, underinsured, and uninsured, also linguistically and culturally isolated individuals, and those that are experiencing homelessness. We empower patients so they can be proactive about their health. We want them to be able to navigate all these barriers on their own, and if they need us, we're always there to help them.
My name is Juan Carlos. I work as a patient navigator at Dignity Health. My role as a patient navigator is to be able to help patients who are coming for non-urgent care to the hospital, connect them to their primary care doctor. Every day I go, the first thing I do is just go and see if there are patients in the floor who are in need. You don't have to say much, but by your body language, right? And the way you express, you are just basically telling the patient that you care. And when they notice that, because everybody can notice it, it's very easy to them to lose their fears and to trust us, in order for us to help them.
I think what's really important is that because we are funded by Dignity Health, that allows us to approach the patients in the ED. And I think that's crucial for that population we serve. Most of these patients, they're not aware that there's an issue until we go out there. If it wasn't for us approaching them, I don't think they would be calling us. It's that in-person approach that Dignity allows us to do, that I believe that's why our program is successful.
Best collaboration we can have. Yeah, because we share the same values. You know what? Everyday doctors, nurses, like all the staff, prove to me that they do care. I can tell you one that I always think about it. It's about a man who had a chromium separation. Basically, the socket, it was just out of the socket, right? And the ligaments were torn. Basically, he was lost because he didn't know he had a primary, he didn't know all the benefits that he could get, he did surgery. So I worked really hard. We worked very hard. As a team, we always connect to each other, if we don't have the answers. And we were able to make sure that he was able to be seen by a doctor in 2 days. And he was seen by the specialist, the following week. And now I know that that person, had surgery. It's okay, he's doing well. And he appreciates the fact that we took interest in, his health needs. And so I never forget about that.
I had a patient call me back a year later just to say, I was just thinking about you, and I just have to say, thank you, because not just you, but everyone in that room. It was a patient that was very hesitant about a procedure, and we just didn't know why. I mean, it was like all of us were around, and he just kept saying no and no. It was a life and death situation because he wanted to be discharged. And I told him, well, the doctors are saying if you're discharged, you may not make it home. He said, you guys weren't my angels because you convinced me. If it wasn't for everyone in that room, I would have left. And who knows what would have been my fate. The techs were there, the RNs were there, the provider was there. We were just informing him of what his situation was. And so it did take all of us for him to stay. It just proves that it does take a community to help the underserved. I just thought that that could have been my father. And there was no one to help him, or it's just I do feel that responsibility. It's my job. I have the knowledge. It's why not share the knowledge with them and empower them? So it's gratifying to hear those stories.
It's basically about walking with them to making sure that they're gonna have access to health care. And not only to health care, but actually to every single resource that they may need.
Preventative care is essential for you to be healthy, for you to be there for your family. It's everything. If you're healthy, your family's healthy.